Helicobacter pylori by Holly Kerwin and Kobe O'Clair. What is H. pylori? H. pylori is from the genus Helicobacter, from the species Helicobacter pylori. It is a gram-negative bacteria. The bacteria is curved, rod-shaped, with multiple flagella. H. pylori is a bacteria that can grow in highly acidic environment of the stomach, which most microorganisms could not survive. H. pylori manufactures large amounts of urease that helps break down urea into carbon dioxide and ammonium, which neutralizes the acid during colonization of the stomach. Flagellar motility of Helicobacter species has been also shown to be essential for successful colonization of the host. Flagella allows the bacterium to swim across the viscous gastric mucus and reach the more neutral pH underneath the mucus. The bacteria colonizes in the gastric mucosa. H. pylori is considered to be a microaerophile, which means the growth occurs where a low concentration of oxygen has diffused into medium. Infection. The stomach mucosa contains cells that secrete gastric juices. Gastric juices contain proteolytic enzymes and hydrochloric acid that activates enzymes. The stomach itself has a layer of mucus that is produced from other specialized cells. When the mucosa layer of the stomach is disrupted, the inflammation of the stomach occurs, and further progression such as ulcers and stomach cancers can occur. H. pylori is the main cause of peptic ulcers in humans. About 30 to 50% of the population in developed countries become affected with H. pylori. The rates in developing countries are higher. 15% of people affected with H. pylori develop ulcers. Gastric cancer develops in 3% of people affected with H. pylori. People with blood type O are more susceptible to H. pylori because of the enhanced binding to epithelial cells. Increased density of colonization of the epithelial cell and higher inflammation responses to H. pylori blood type O contributes to increased susceptibility to peptic ulcers. Some signs and symptoms include aching or burning pain in the abdomen. The pain is worse when the stomach is empty. Loss of appetite and unintentional weight loss. Nausea. And frequent burping and bloating.
One of the ways to check for H. pylori is a blood test. The blood test is done to check whether your body has made antibodies to the H. pylori bacteria. If your body has antibodies to H. pylori in your blood, it means you are either currently infected or have been infected in the past. Studies show when infection occurs, there is nearly always development of the IgG antibodies, which have the function to protect against circulation of bacteria and viruses, to neutralize toxins and viruses, and to enhance phagocytosis. Another way to test for H. pylori is a urea breath test, which checks to see if you have the H. pylori bacteria in your stomach. This test can show if you have the H. pylori infection, and it can also be used to see if the treatment has worked to get rid of the H. pylori. H. pylori produces an enzyme called urease, which breaks down urea into ammonia and carbon dioxide. During this test, a tablet containing urea is swallowed and the amount of exhaled carbon dioxide is measured. This indicates the presence of H. pylori in the stomach. A stool antigen test can also be done, which checks to see if there are substances that trigger the immune system to fight off H. pylori infection and are present in your stool. The stool antigen test can be done to help support diagnosis of the H. pylori infection or to find out whether the treatment was successful or not. A small sample, which is a biopsy, can also be taken from the lining of your stomach or the small intestine. The doctors use a thin, flexible, light viewing instrument called an endoscope to look down into the throat and into the stomach. The doctor can see irritation or inflammation in the lining of the stomach. A tissue sample will tell if the cause is H. pylori. The stomach biopsy is very accurate, but is also the most risky out of the 4 tests. Results from the urine breath test or the stool antigen tests are usually available within a few hours. Results from the blood antibody test are usually available within 24 hours. And results from the biopsy samples are usually available within 48 hours, and results from the biopsy samples that is cultured can take up to 10 days. It is important to consider that blood tests for the H. pylori may be positive for several years after the infection. Therefore, the urine breath test, stool antigen test, and the biopsy may be used to find out if treatment has been effective. Medications such as proton pump inhibitors, histamine blockers, and medications like Pepto-Bismol are recommended. These medications help because they either neutralize stomach acid or decrease the secretion of the acid in the stomach. These have been effective for many years to treat ulcers. However, the medications do not rid the body of H. pylori, and ulcers frequently return after discontinuing. Therefore, most people continue to take them for a long period of time. H. pylori is difficult to eradicate from the stomach because it's capable of developing resistance to commonly used antibiotics. Therefore, 2 or more antibiotics is usually given together with the medications mentioned earlier. Examples of combinations of medications that are effective are clarithromycin, amoxicillin, and omeprazole. These are usually taken twice a day over the course of 14 days. Antibiotic resistance is on the rise. This can occur when a disease-causing organism changes over time and adapts its ways to allow them to survive to the exposure to a medicine that in the past killed or controlled them. An antibiotic sensitivity test is done to help choose the antibiotic that is most effective against a certain type of bacteria. Some bacteria are resistant to certain antibiotics because of differences in their genetic material. Drug-resistant bacteria usually develops because of the entire course of antibiotic treatment was not completed. Stopping drug treatment early only kills the bacteria that are sensitive to the drugs, allowing resistance bacteria to multiply and cause an infection. Risk factors include living in a crowded condition, living without supply of clean water, living in a developing country, and living with someone who has H. pylori infection. It may be passed through person to person through direct contact with saliva, vomit, or fecal matter. It also may be spread through contaminated food or water. Prevention of H. pylori can be done by making sure you're drinking clean water, performing hand hygiene, and making sure you're eating food that has been properly prepared.